Tennessee taxpayers possibly overcharged by millions for the health insurance of other people across the state. Good evening, everyone. I'm Rory Johnston.
I'm Vicki Yates. The state of Tennessee provides health insurance for more than 140,000 state employees and retirees. But a News Channel 5 investigation has found that the state and, in essence, taxpayers have been overcharged, potentially by tens of millions of dollars.
So what has the state done to get some of that money back? Our consumer investigator Jennifer Krause discovered the state did pay for an audit.
But wait until you hear what one former state lawmaker says about that.
It appears to be a waste of taxpayers' money.
Martin Daniel, a former state representative from the Knoxville area, can't believe you just paid for this audit.
What did we get?
We got a half-done audit.
And it tells us what?
Tells us very little.
But more than that, he's shocked that the state overpaid for state employee medical care and no one seems to care.
For example, we would see on one hand where a colonoscopy would cost in one place $800 and in another place $16,000. Of course, that's at the taxpayer's expense.
Daniel was so concerned about the overspending that 2 years ago, while he was still in office, he called for a fiscal review of the health plan.
I'm talking about auditing the entire performance, the bills that have been received by the administrator, the amounts that have been drafted from the state checking account.
An outside company was brought in and reviewed some 5 million Blue Cross Blue Shield and Cigna claims filed between 2017 and 2019. And what they found was staggering.
They determined that there were at least $17 million in erroneous payments made under the state health care plan.
$17 million.
Yes, and they also found that, or suggested, or had suspicion as to $22 million in claims that they felt like needed a closer look.
That's potentially close to $40 million in taxpayer money that, according to the cursory review, the state overpaid. But instead of trying to find out what happened to all that money and even trying to get at least some of it back, guess what the state of Tennessee did with that information? Nothing.
Motion without objection is ordered.
When state lawmakers approved money last year for a comprehensive full audit of the health care plan, instead of going back to find those tens of millions of dollars from 2017 through 2019, Tennessee Attorney General Herb Slattery and his office hired another company and told them to look only at data from 2020. And while that first review, again, found somewhere between $17 and nearly $40 million in erroneous payments to the insurance companies, the audit of claims from 2020 found just $268,000 in overpayments to Blue Cross Blue Shield and just under $1.5 million to Cigna.
There's a big difference.
Yes.
I was a little surprised with the lack of findings, to say the very least.
Stephen Caraba's company, Claim Informatics, did the original review of claims from 2017 through 2019, and he too couldn't believe how little the full audit found.
How much more do you think they could or should have found?
At least 20 times the amount that they found.
Healthcare Horizons, the Knoxville-based company which did the audit of 2020 claims, refused to discuss or explain how there could be such a huge discrepancy. We also asked the AG's office.
Shortly before Attorney General Herb Slattery left the job at the end of August, his spokesperson told us he'd be up for talking with us about the audit. But when she learned that we wanted to talk about the critical things people were saying about it, suddenly he had no comment.
But what about all those millions of dollars the state overpaid in 2017 through 2019? The AG's office told News Channel 5 Investigates they chose to focus the full audit on the most recent and comprehensive data available. But Martin Daniel asks, why pay for a new audit that totally ignored the previous findings?
I think that the people deserve answers with regard to money that's being spent for audits like this.
The state paid $174,000 for this audit. Now, the AG's office tells me they would have had to have paid $490,000 to do a full audit of those 2017 through 2019 years. That's the only way they say they would have had enough information to go back to try to recoup some of those potentially tens of millions of dollars. Martin Daniel, though, thinks that would have been money well spent. He is now reaching out to current state lawmakers, hoping that they will take notice and perhaps even get the state comptroller's office involved. Jennifer Krause, News Channel 5 Investigates.
Jennifer, thank